Hi, good morning. Happy Sunday to everyone. I wanted to talk to you about a subject very dear to my heart today, which is lifestyle medicine. And I wanted to address some controversial issues as well. As it turns out, I thought of doing this because I am going to be speaking at a conference in Edmonton, and I saw through Google Alert that some skeptics over there, particularly somebody called Timothy something or the other, who's a professor of law and science and a professional skeptic, objected to my being invited to come to speak at this autism conference on the future of well-being. I want to make it clear, I'm not speaking on autism. I wasn't asked to. I was asked to speak on the future of well-being and how it relates to well-being in many areas of life. So I know this is a favorite topic of mine and that many people here are also interested. Let me address the evolution of what started out in the 1980s as mind-body medicine, and then what was referred to as alternative medicine, and then integrative medicine, and so on. And now most frequently used expression today is lifestyle medicine. So this is an evolution in our thinking. In the 1970s, I was training as a resident in internal medicine. I got my boards in internal medicine. And then I got my boards in endocrinology, and I got very interested in neuroendocrinology. And at that time, there was great interest in the opiate receptor and other molecules in the brain that were frequently referred to as the molecules of emotion. Candice Pert, a friend of mine who later became the chief of brain chemistry at NIH, actually first used the expression molecules of emotion, and she was also the one who discovered the opioid receptor, and she actually wrote a book called Molecules of Emotion, where I happened to write the foreword to that book. I had previously published a book called Quantum Healing, and that book was published, I think, in 1988, and I republished it this year with revisions and an update that I did with all the validation over the years for some of the propositions made in that book. And Rudy Tanzi, who wrote Super Brain with me and also Super Genes, was very kind enough to do the foreword. Of course, many people vilified the whole quantum healing title and the book, and particularly professionals who thought I was misusing the word quantum. I've explained many times that what I meant by quantum healing was metaphorically a sudden shift in consciousness can cause a sudden shift in biology. That's all. So, a quantum leap is a phrase that's frequently used, both metaphorically and literally. So, in physics, in quantum mechanics, a quantum leap is when a subatomic particle, an electron, moves from one location to a new location without going through the space in between. So it's here and it's there. So as a metaphor, what I suggested is that when consciousness takes a quantum leap, then biology takes a quantum leap as well. So, for example, if you have just been given terrible news like you have cancer. Your body immediately goes into biological and physiological chaos. And then 5 minutes later, you're told, oh no, that was a mistake, that was somebody else. And your biology immediately then goes into a state of joy. And the shift is instantaneous and doesn't have a linear progression from fear to peace of mind or relief. So in one case, when you're scared and fear, your biology may show a lot of inflammation, high levels of adrenaline, cortisol, high blood pressure, high heart rate, etc. And then immediately when the sense of relief comes, or an experience of love comes, or peace of mind comes, then immediately the biology shifts from biological chaos with high levels of inflammation, inflammatory markers, cortisol, adrenaline, to suddenly serotonin, opiates, all kinds of wonderful things. Opiates, serotonin, dopamine, oxytocin flooding your circulation, and there was no shift from one to the other. So that's basically what quantum healing is. Now, of course, over the last 30 years, there has been an amazing amount of work that shows that our states of consciousness, whether they are fear, guilt, depression, shame, hostility, anger, or love, compassion, joy, equanimity, they all have corresponding biological states. So consciousness and biology are intimately linked, and biology is different in different states of consciousness. So once we get that, I think it's very clear that quantum healing was an appropriate title. And so there we are, 30 years later, lots of validation. In any case, this interesting episode sparked my interest in talking to you about this same thing, my going to Edmonton, and this hoopla raised by this skeptic, Timothy something or the other. I'll remember his name, but he's a professor and skeptic, and it actually, in his blogs, he makes some interesting points. Right now, the situation is this, and it's very clear, this situation in medicine. Only 5% of disease-related gene mutations are fully penetrant, which means there's a one-to-one correspondence between the disease-related gene mutation and the disease. And that means that mutation will result in that disease. This is true of all chronic diseases, autoimmune diseases, various types of cancer, and also diseases associated with inflammation, like bronchial asthma, heart disease, coronary artery disease, just about any disease. If you think of chronic illness, then there are 5% of disease-related mutations that are fully penetrant. In the remaining 95% of disease-related gene mutations, you get increased risk for the disease, but the mutations don't guarantee the disease, which means lifestyle factors are involved. And I mentioned many times that these lifestyle factors include good sleep, meditation and stress management, mind-body coordination through yoga, because the different postures of yoga actually are seats of awareness that stimulate the autonomic nerves and include self-regulation and induce self-regulation in different organs. So the very specificity of these yoga postures induces self-regulation in different areas of the body. And the same is true of also what we call breathing techniques of pranayama. There are over 100 of them, and there are pranayams to increase heart rate, to decrease heart rate, to increase endurance, to increase energy, to calm you down, to cool you down, etc., etc., etc. So there's a lot of evidence now that yoga and pranayama can be used specifically to induce self-regulation in different organs. Of course, exercise and movement are part of the lifestyle change that is needed. Healthy emotions that connect you to everyone, and nutrition. Now, a lot of people are objecting, saying, nutrition, exercise shouldn't be considered alternate, but they were. When I was in residency, to say that nutrition could have an effect on chronic disease was heresy. We didn't know anything about nutrition and the microbiome then. We didn't know how the microbiome and the human genome interact together. We didn't know anything about epigenetics. So nutrition actually is much more than common sense. There are various foods that decrease inflammation. There are various foods that have an effect on the microbiome that are prebiotic. There are foods that help the microbiome move in a more homeostatic direction. So actually food can be used as medicine, especially foods that are rich in phytochemicals, and they're high up the food chain, and they represent the energy of the sun. Foods that have all the 7 colors of the rainbow, and also the 6 tastes of life. It's like sweet, sour, salt, bitter, pungent, astringent. So food can become a pharmacy. Also, people have been critical of the word placebo, which is a convenient word many people use to say it wasn't really biological, but the word placebo may be misleading. When somebody has a placebo response to, say, a sugar pill that has been touted as relieving pain, then they actually have increase in their opiates that can be blocked by Narcan, which is a narcotic antagonist. So placebo is the mechanics of consciousness turning into biology, and many rituals in many traditions actually harness this power of consciousness to change biology. So too, sensory modulation, whether it's sound or texture or taste or smell or any of the 5 senses, can be used to bring about and evoke the healing response from within. So this is very important for us to understand. The very fact that 95% of disease-related gene mutations are not fully penetrant means there's a lot that we can control. I agree then that we shouldn't use the word alternative medicine, and maybe not even the word integrative, although those words are here and they are part of our cultural language. But if lifestyle medicine became mainstream, which it is slowly becoming mainstream, notwithstanding the naysayers and the critics, then much of what we call conventional traditional medicine could become alternative. Because it's true that most of coronary artery bypass graft surgery or angioplasty does not change mortality by more than 1 or 2% if you have stable angina, not unstable angina, in which case it can be life-saving. But most of the angioplasty and coronary bypass graft surgery that's done is actually from stable angina. It's also known that about 40% of people in hospitals suffer from iatrogenic disease, which is disease as a result of medical intervention or side effects from drugs or medical accidents, etc. The number one cause of drug addiction in the world is not street drugs, but medical prescriptions legally prescribed by physicians. In fact, physicians are more addicted than any other profession to drugs, and because they have easy access to these drugs. And physician burnout is a very important factor in the ill health of physicians, and the scourge of addiction is much more dominant in physicians and even psychiatrists. So we have to be careful before we attack lifestyle medicine, or we attack so-called integrative medicine, that we actually do not practice our own self-awareness as physicians. So this is not to mean that regular medicine is not helpful. Regular medicine is very, very helpful if you have acute illness. If you have broken your leg, you need an orthopedic surgeon. If you have an acute appendicitis, you might need surgery immediately. If you have pneumonia, you probably need an antibiotic immediately. But just remember that most of chronic illness in society is a result of lifestyle, and it doesn't get the natural history of the disease does not get altered by medication, pharmaceuticals, or even surgery. I just remember the name of the physician who's apparently getting a lot of publicity, and good way to get publicity, by attacking me in Edmonton. His name is Tim Caulfield. So Tim, I'm going to send you a link to this, and would love for you to respond, because you are not being fair in your criticism. Lifestyle medicine should be a mainstream medicine, and what is now mainstream medicine should be alternative, used only for acute illness and sometimes for chronic illness. I think if you don't understand this, then you're frozen in an obsolete worldview. And so I do hope that you will watch this video and respond. I've also invited you to my talk, and I'm going to cover lots of things in my talk, including the various pillars of well-being. I'm going to show the latest research on epigenetics, on the microbiome, and I'm also going to show the evidence for lifestyle medicine being the most important thing, and why it should be mainstream. So, in summary, 80% of pharmaceuticals are of optional or marginal benefit, which means that if you didn't use the drug or the pharmaceutical, it wouldn't alter the natural history of the disease. So I just noticed a note here from my co-founder and CEO of GIO, which is the Internet of Wellbeing, and he's saying lifestyle medicine is already mainstream. Agree with you. Cleveland Clinic, Abu Dhabi is fully behind us. So once again, Tim, what's his name? Tim, why can't I remember his name? So this doctor who's being very critical that I just mentioned in Edmonton, and he's got a bunch of people who are supporting him as well, all frozen in an obsolete worldview. Dr. Tim Caulfield. Dr. Tim Caulfield. And he went on CBC News locally to say that it was a very poor decision to invite me to give a talk at this conference on autism. By the way, I was not asked to talk on autism, but on the future of well-being, which is what I'm going to do. But having said that, there's a lot of evidence now that dysbiosis could be a factor in autism. As you know, autism is a very wide spectrum of disorders, and so it's not one thing. Just like cancer, there are so many cancers, and even in the different organs, so many types of cancer. So we can't make a blanket statement about autism or cancer, except that anything that involves lifestyle changes that brings about self-regulation or a return to homeostasis can only help the disease. Okay, in summary, 80% of pharmaceuticals are of optional or marginal benefit. Most drugs in a hospital, and I can attest to this, and there's data on this, are used for 5 things: pain, anxiety, nausea, insomnia, and constipation. And if you want to remember the acronym, it is PANIC. 36 to 40% of people in hospitals suffer from iatrogenic disease. It's the equivalent of 2 jumbo jet crashes every other day. No other industry would tolerate that. And the number one cause of drug addiction is not street drugs, but medical prescriptions that are prescribed by doctors. Doctors suffer the highest level of burnout while they go about criticizing people, some of them, who are suggesting lifestyle medicine. So not only doctors suffer higher incidence of burnout, more suicides, more alcoholism, more drug addiction. Physician, heal thyself before you criticize others. And what else did I want to say? The 5 pillars I mentioned of well-being, and add to that restoring biological rhythms, some new evidence from what is called grounding and being in nature, and basically taking it easy, and healthy emotions, love, compassion, joy, equanimity, all causing self-regulation. So I'm looking forward to my visit to Edmonton in January. And Dr. Caulfield, I hope you can come and bring along your team of skeptics, and hopefully we can engage in healthy dialogue. But you don't seem to be wanting to do that because you don't want to lose your thunder and just stop attacking people who don't agree with you. Okay, so all the best, and I'll be in touch. And thank you for participating and listening to this conversation. Now I'm going to look at some of your comments and respond to that. Gwen McFadden, conversation is where it starts. Healthy conversation is best. Punacha Machaya says, check in my.cleveland.org/services/wellness/integrative medicine. Our service provider is Jayo.com. Look it up, Jayo. And we provide lifestyle medicine on the internet, including stress management, meditation, nutrition, exercise, various yoga techniques, breathing techniques, and much, much more. And do check it out. Please check out Jayo.com. I hope Dr. Andy Holt, who has also been very critical, checks it out, and Mr. or around 10 on Twitter, check it out. Tim, check it out. You might actually benefit from Jayo.com more than you think. Let me see what other people are saying. Ingrid Portuguese says, thank you for all this advice. Aleem Iqbal says, needed this at this juncture. Thank you, Aleem. Shirin Sultani, how did you come to find 80%? Shirin, actually go on the internet and do your own research. Don't have to believe me. Check out things like most frequently prescribed pharmaceuticals. Check out iatrogenic disease. Check out medical accidents. check out Biology of Placebo, and then you can learn a lot. Marie DeCour Jackson, The Body Can Heal Itself of Disease. Well, the body can return to self-regulation, and that is really important to know. And unfortunately, the part of our training is not about that. Hopefully it is changing. At the University of San Diego Medical School, where I have a professorship, we actually do practice integrative medicine, and we have a Journey into Healing course, which is recognized by UCSD Medical School and the American Medical Association for about 23 hours of what is called CME credit for physicians. Punacha is again back. He's saying Cleveland Clinic Center for Integrative and Lifestyle Medicine is dedicated to addressing the increasing demand for integrative healthcare by researching and providing access to practices that address the physical as well as lifestyle, emotional, and spiritual needs of patients. So I think that's enough for today. I do want to thank our friend Timothy in Edmonton for bringing so much attention and being so critical. It looks like we're going to sell out, and it's going to be an amazing experience for me and for everyone else. Tim, once again, do come. Take care, and all love.